Well, this is a vacation time.
Okay, I think we should get started despite some technical difficulties.
Around the 15th of August.
And good morning. Thank you for joining us today for Marxe talks on COVID-19 responses in the United States, China, and Italy. And before we start, we ask you to kindly mute your microphones. I also let you know that we're going to record this event, and the recording will be available posted on the Marxe YouTube webpage. And again, good morning. Thank you for joining us on Marxe talks on COVID-19 responses in the United States, China, Italy, lessons learned. My name is Chen. I'm a professor at the Marxe School for Public International Affairs here at the Baruch College. It's my great honor to moderate this panel. The ongoing coronavirus pandemic took all of us by surprise. The scale and scope of the challenges created by the pandemic have not been seen in nearly a century. As of today, there's 22.5 confirmed cases with a death toll of close to 8,000. As the coronavirus continues to devastate lives around the world, it is important for us, I think, to reflect on what we did in the past and reimagine the future. One of the puzzles I always feel is the significant country-to-country variation in their responses to COVID-19. Why did a different country respond so differently to the same public health crisis? To address this question today, we invite three panelists from the United States, China, Italy to share their perspective on their country's COVID-19 responses. We deliberately chosen the three countries for a cross-country comparison, partly because these countries are epicenters in three different continents. More importantly, these countries took vastly different pathways to fighting the virus. So I'm going to moderate today's discussion. Just to let you know that we have chat boxes and we have our panel discussion. And after that, with 30 minutes Q&A, you can type in your question, comments into the chat box. So now I'm going to introduce our three panelists. So the first panelist, Jessica Greene, one of my colleagues at the Marxe School, and she's a professor and Luciano Chair in healthcare policy. She evaluates health reform-related policies and strategies to improve the quality of healthcare, including financial incentive, public reporting of provider quality, and consumer engagement. She has published widely in top health policy and primary care journals, including Health Affairs, the Mailbank Quarterly, the Annals of Family Medicine. She currently serves as a deputy editor for the Journal for General Internal Medicine. Prior to joining the Baruch faculty, she is a faculty member at the George Washington University and the University of Oregon. Our second panelist is Professor Dahai Zhao with the School of International and Public Affairs, Shanghai Jiao Tong University, SJTU. He is a executive director at SJTU Yale Joint Center for Health Policy. He is a frequent contributor to the media outlets, including China Global Television Network, Shanghai Dragon TV, and Shanghai TV News channels. And he was a visiting scholar at the Yale University. Since the outbreak of the pandemic, Professor Zhao has made 44 live presentation comments to multiple media outlets. He has also published 3 COVID-19 related articles. Congratulations. Our friend from Italy, sorry for some technical difficulties, but he's still able to make it, is Carmine Bianchi. Forgive my pronunciation, I try my best. And Professor Bianchi is with the Department for Public Finance, University of Palermo in Sicily. He's directing the doctoral programs in model-based public planning, policy, design, and management, as well as the master program in public management. He has extensive research and consulting experience with the public and private sector organization in designing policies and linking policy design to outcome-based performance management systems. Professor Bianchi has served multiple editorial boards, including International Journal for Public Administration Review, Public Management Review, Public Performance and Management Review. He's also editing a Springer book series, System Dynamics for Performance Management and Governance. Thank you all of you for your contribution to join us today. So let me begin with the first questions. I'd like to ask each panelist to give us some updates about the current status of a pandemic in your country. So I think I can start with the Professor Zhao from China, please. Please mute yourself. You didn't mute yourself. Yes, please.
In China, the pandemic seems to be under control. For example, for the past 1 week, no new confirmed cases of COVID-19 have been reported, except for the imported cases from outside of China. Yeah, I think it seems to be under control. Yeah.
So what about Italy, Professor Bianchi?
Oh,
Not yet.
Can you repeat that?
So Professor Bianchi, we'd like to ask you to give us some updates about the current status of pandemic in Italy. Can you hear me?
Could you hear him? He's asking for the current status of the pandemic in Italy.
Oh, yeah. I cannot hear anything. I wasn't able for all the time
to hear anything. Oh.
Anything. Yeah.
So I wonder what happened because.
Yeah, I can answer, but of course, this is. Is there a possibility to share the screen? Can I share the screen now? As I have some slides to make more synthetic my answer.
Sure.
I can.
Yeah.
Okay. Yes.
You are.
Okay. Well, I have to reboot. I rebooted also the system before it attends to current status. Here we are.
Yes, we see it. We did see it.
Difficulties in sharing, please let me know. Well, the current status. The issue we are talking about, in my opinion, implies understanding particularly what topic are we talking about. Is it only health care, or it is the wider system encompassing from different subsystems associated with health care, education, penitentiary system, welfare, food supply, foreign affairs, immigration, business, last but not least. We have an issue regarding not only prevention and recovery, but also resilience. To understand the current status of the system in Italy, we have to consider that Italy is the second oldest society in the world after Japan. Here you have the fraction of people older than 65 years, and this is a different kind of age distribution analysis. This is important because in the first stage of the evolution of the problem, the most affected people have been over 60 people, 60 years old people. Now the problem is affecting younger people. This statistics is from the end of July. It says 40 years old people. Now the newspaper says even on average 30 years old people. This is because after having solved, between apostrophes, the problem, in Italy, more people, in particular younger people, have been used to go abroad, particularly overnight, and this kind of a silent contagion is affecting this this area of this group of population. And this may generate more problems, even though it is not as dangerous as it was in the period between February and April. This could be a new surge of the problem. This is this graph gives an idea of the profile of the total cases we had from February to now, and this is the total number of active cases. So you see there was a rise in the first case in the first stage until April, big surge of cases, and then a gradual proof of the ability of the Italian system to find a solution to the problem after a lot of pains. And now there is this silent symptom of new growth in the cases. This is important. The cumulative cases in Italy account for a 70% of cases from only 1, 2, 3, 4 regions, and particularly the 38% from Lombardy. We will see these implications later in my comments, even in the next stage of our debate. But I want to give you a very short profile of what happened in Italy. It is said that the case of the problem of COVID was already silent probably in January, February in Italy. Nobody realized that. I want to skip this in order to get to go directly to the point. And task force was set up, however, by the Ministry of Health on February the 4th. And the first Italian patient was hospitalized for pneumonia at the Codogno Hospital in Lombardy. And at the same time, other cases emerged in Veneto. And a person died, 77 years old. After that, people reacted, particularly the opposition party, by saying that there was an unjustified alarmism. This implied that on the 28th of February, there was just even an opposition by the opposition party, just to say, well, we don't need any kind of shutdown. But gradually, the national government tried to answer, to fix the problems by getting closed schools and universities. And on the 8th of March, it happened a very strange situation. The government prescribed severe movement limitations to only Lombardy, as was really severely affected by the problem, and huge quantities of people went to the station of Milan in order to go to the south. That was a big problem, which was a big symptom of unfortunate, of lack of organization by the public sector. Then we had, starting from the 9th of March, the first Prime Minister decree, stay at home, but this was not still a lockdown, and from that time severe saturation problems happened in Lombardy healthcare. Only starting from March 22nd, a full lockdown was decided, and this implied that gradually the surge went down, the surge of cases, so that the Prime Minister could start through a Prime Minister decree, the phase 2, which implied a gradual reopening by May the 4th. And by May the 16th, the Prime Minister decree, another decree, authorized the reopening of restaurants and bars by May the 18th. Then on June the 3rd, the Prime Minister decree, another one, announced the reopening of inter-regional mobility. So it was something like 3 months later than the shutdown decision. And that was, in a sense, a start of phase 3. And by August the 7th, a legislative decree allocated 25 billion euros to sustain the economy. This is important to consider to understand what's the situation now. The official numbers do not give an idea of what actually are the real
Professor
numbers.
Bianchi, I think we have limited time. Would you be a little bit brief so we can move on
Professor
to...
Bianchi, I don't know if you just heard, but Chen has said we have limited time, and so I think we need...
I don't hear anything. I only hear myself.
So I think
just estimated that 9.8% of cases of real.
So Jessica, could you ask him to just save it for the future, next round?
Multiply the case by 10. So this is the message.
Okay.
So Jessica, probably you just gave a very brief update about the current status in the United States.
Yeah, so I'm gonna see if I can show my screen, but that might be too much to try to figure out. So hi everyone, as you probably know, we are really still in the thick of things. The US has 4% of the world's population, but 22% of all the COVID deaths. We actually don't have the largest death per capita, though we do have the largest number of deaths of any country. And we are still in the thick of it. Deaths per capita are still over 1,000 a day, or sorry, deaths are still over 1,000 a day, and deaths per capita in the last week are higher than any other industrialized country. Cases are starting to fall, so maybe there is some hope soon, but that's where things stand.
Okay, good. So I think on reflection, the different countries' responses, I would like to ask a second question, that is, what has distinguished or differentiated your country's pandemic response from other countries? Shall we also start with Professor Zhao? You mute yourself. Please unmute yourself.
No.
Yeah, I will answer it very briefly. Okay, yeah. Chinese central government mobilized all local governments and all population to address the pandemic at the very early stage of the pandemic, to take the pandemic, to take contain COVID-19 top priority. I think the Chinese government utilized the stringent measures to address the pandemic from the beginning to the present. So I think there are some differences between China and some other countries. Yeah.
So what about Jessica?
So what's distinguished our country's pandemic response is sort of unfortunate, I would say. It's a lack of honesty from our president in terms of diminishing the seriousness of the pandemic, from saying it's going to disappear at the start, to comparing it to the flu, to saying we have the lowest fatality rate in the country, in the world, sorry, and also inflating the effectiveness of the country's response by saying anyone that needs a test gets a test. And second, we have an inadequate federal response. So we're 6 months in and we're still having shortages of testing and personal protective equipment like masks and gloves. We have Republican governors saying that states are competing on the open market with each other and the federal government to get supplies. And so the Trump administration has delegated to states and has not had a sort of central approach to how to help. And when it has tried to act, like for nursing homes where 1/4 of all the deaths have occurred, They started sending masks and gowns for 2 weeks supply in May and June, and the quality was inadequate and the quantity was inadequate. And now they've started sending nursing homes testing machines so that they can do point of care tests, but they've started sending them with no information about when they're arriving or how to use them. So it's really just been incredibly confusing and inadequate.
Thank you. Professor Bianchi, or what?
So hold on, let me try to switch things over to Skype.
Sorry, Jessica, for
Yeah.
the double work.
No problem. Here, the question is about to be
what has
the second one, yeah, what
yes.
distinguishes my country in the pandemic. Yeah.
And we just have like 2 or 3 minutes.
Yeah, I'm sorry not to be able to interact directly and to follow the discussion as I am I'm not able to. But actually, I have a slide that can summarize this. One is the timing for virus spread perception. The timing was pretty long. It took about 1 month, maybe more than 1 month, to realize what was happening, going on. The lockdown length, and this is a positive issue, in my opinion, was significant, and that was a good thing which distinguished the Italian response to the pandemic, as it allowed Italy to isolate the problem and eventually to fix, at least for the time being. Another peculiarity is the balance between centralized and decentralized decision making. At some point, starting from the 20th of March or so, government decided to take every decision by itself, which is pretty contradictory because in general complex problems would need collegiality, but this kind of centralization was probably a possibility, or provide a possibility to find some immediate solutions to problems which were dangerously surging. And the centralized decision making was up to the possibility that governors from regions and even mayors could apply and find possible specific measures to emphasize more the directives of the government. And the other characteristic is the fact that by constitution, health is a fundamental right of the individual. So this is an important thing, as government, the national government has said that whatever it is needed, we need to solve the problem of COVID, even for poor people. However, another of not necessarily negative points, but factors to consider, which are peculiar of Italy, are the need to cope with and deal with the differences between the healthcare systems, regions and municipalities. There are differences from north to south, and in the north, from Lombardy and Veneto, the way the two systems acted and reacted. Lombardy was a nightmare. Veneto was a good sign of response, because Lombardy is more private oriented, and Veneto is more public oriented, and for the need to, I don't want to say save money, but to stay into the budgets, Lombardy decided not to have any early testing. This caused severe problems. Digital divide was another problem, as when we want to have online education, you need proper servers. Initial political instability in Italy and low trust in government was a problem, and actually the national government was used, not misused, but positively used the problem to build trust. the level of trust towards the national government is not much higher than it was at the beginning of the year. Even societal, cultural issues are important to consider. Families, friendship, families in Italy in general, and not just single couple families. In general, there are different layers of families, so people are oriented to have gatherings. So this may generate problems in terms of contagion. Same for friendship. High financial constraints. Unfortunately, the GDP debt ratio is very high in Italy, and this has generated problems in terms of finding budgets. But proper answers have been found by the high institutional fragmentation. When you talk about policing, you may talk about national policing and local policing, and coordination is not easy. And tough red tape in the public sector is another issue to consider. So the need to cope with these issues have characterized the pandemic response to Italy. The tough red tape in the public sector, particularly for the supply of protection masks and even equipment, it may take months, if not years, in order to get the supply. And in this case, eventually Italy has been able to cope with these issues with the delay, unfortunately. Okay, I would stand by.
Okay, thank you. Thank you so much. I think the last two panelists, yes. I think the last two panelists already addressed some parts of my next question. Now, my next question probably more targeted at Professor Zhao is. So on reflection, what are those things you wish Chinese government could have done differently?
Actually, Chinese government has done a pretty good job for combating the pandemic of COVID-19. All of government and all of society approaches have confirmed, validated. However, I believe the early monitoring and surveillance system for new major infectious diseases needs to be dramatically improved, particularly at the very early stage of the outbreak. The Chinese CDC should do more. Yeah.
Okay. So what about Jessica? What could the U.S. government could have done differently? I think there's a lot you can talk about, but just be brief. Just be brief.
I'll be brief. So let's start with valuing public health experts and science, not politicizing actions and behaviors that protect people from COVID. President Trump didn't wear a mask until July. He said people who wore masks were doing so to show that they didn't like him, not because they cared about COVID. And perhaps, well, they're all important, but having a federal effort to manufacture and distribute masks, gowns, and tests.
Okay, good. So I think the next thing I probably ask you to discuss, so as we all know, the healthcare system are under strains because of this pandemic. I want you to share with us in different countries, how's your healthcare system overcome the flow of the patients and trying to flatten the curve? What are things your healthcare system doing trying to keep it flow? You can start with Professor Zhao.
Yeah, in February, the pandemic of COVID-19 in China was at the peak. It was really difficult for the operation of our healthcare system. We, at that time, we needed more hospital beds, healthcare workers, more medical supplies. We, at that time, we did that. First, if it was not necessary for the residents to go to hospital, just stay at home, online doctors or online hospitals played an important role in helping the residents. Second, the central government of China collected the healthcare workers and medical supplies from all over the country to help the epicenter. Third, the government tried the best to produce the medical supplies, such as medical face mask, etc. Yeah.
Okay, good. I think that this is a very interesting sharp contrast to what happened in the United States. But as far as I know, when the New York City is experiencing the high peaks, we actually have a lot of healthcare professionals coming from other states to voluntarily help us to overcome these difficulties. So Jessica, what are the other things healthcare system in the United States do in trying to overcome these challenges and difficulties?
Sorry, I'm trying to get Skype to work, and I'm struggling to keep Carmine in. So, you know, our healthcare system has been overloaded in certain parts of the country at certain times. So in New York, there were efforts to bring in healthcare workers from less impacted areas, increase the number of hospital beds and ICUs with tents, and some of that was effective. Other things like creating field hospitals and convention centers, we spent millions of dollars on and were actually not used at all. And that was months ago, so you'd hope that there'd be a lot of learning since then, but in Texas, there are now hospitals that have been reaching capacity, and we're having to allocate ICU beds based on who they thought was going to be most likely to survive. The governor then did send in some Navy teams to help so hospitals could transfer patients, but we've had a lot of struggle in how to do this effectively.
Thank you. So one of the challenges, do you want to continue or?
No, if you're talking to Carmine, I think he is on the phone through Jonathan, and we can connect that way.
So can we talk to the Professor Bianchi also how they cope with the overflowing of the healthcare system in Italy?
Just lost a lot of things. I understand that. But is there a possibility to share the screen as well? Or
yeah, I can do that.
I can go, as I would have liked to show you some aspects which are peculiar and I couldn't show you before. But I don't know whether, yes. Okay. All right. Can you hear the? Can you see the graph? I think this graph is important in order to understand what happened in two important regions in Italy, Veneto and Lombardy. The fraction of total cases of population was and has been much higher in Lombardy than in Veneto. Veneto and Lombardy are very close to each other. This is the same kind of graphs that gives an idea of what happened, and so the peak of the values of cases and even the length was much higher in Lombardy. This video gives you a lot of insight.
Okay, I can't hear anything or? I can't hear Professor Brown. Oh, okay, it's a video. Okay. I think probably we stop sharing the video to say for the purpose of the time.
Can you see the video?
A little bit. I think I'll probably just stop there, and it's difficult.
Some problems with the video.
I have no clue, and what I can see is just the video. I'm not in the system.
The video is playing. It's good.
But we cannot hear anything. I mean, I think we just stop this.
20 seconds.
Can we just stop video here, or? So Jessica, you mute yourself.
I'm sorry, I've stopped the video because it wasn't working. So
Okay. I think we move on to the next question, maybe for the purpose of time. So, I think the one of the things to effectively containing the viruses is the citizen compliance with very restrictive stay-at-home orders. I know there are very variation across different countries. In China, citizens completely follow the government rules. In the United States, we have traveling doing that. Italy probably in between. So I want to give your perspective of why in your country citizens are willing to or not willing to follow very restrictive stay-at-home orders. I heard somebody say it's actually more about the cultural issues. I want to have your take on that. Professor Zhao, please.
Yeah, I just know Chinese people. For Americans and Italians, I think the two professors know much more than me. For Chinese people, I think mostly because of the outbreak of SARS in 2003, Chinese people have a basic knowledge of pandemic. In addition, Chinese people are allowed to follow the government orders. The most majority of Chinese people understood and have complied with stay-at-home orders. In addition, I believe the national culture may influence the compliance. However, I also believe whether there is a constant government containment policy is more important. As far as I know, in some countries, the federal or central government often changed the containment policy. So I think, yeah, that's my answer.
Okay, Professor Greene. Oh, what happened? We lose him. Jessica? Jessica, okay.
Yeah, Jessica temporarily got disconnected, but she is connecting now.
Okay.
We could have Professor Bianchi talk through my phone.
Yeah, Professor Bianchi. So what about the citizen compliance with the stay-at-home orders in Italy?
Well, citizens responded very positively with a very unexpected identification to the needs of shutting down. I have just one slide that I cannot share, but sometimes symbols and images talk more than just talking. So I would like to say that a lot of images that reflect the behavior of people are the consideration for the service by doctors, medical doctors, and even nurses. There is an image of a nurse who takes like a baby, Italy as a shape of Italy, just trying to having care of Italy. This is a typical symbol of doing that. The other one was the way people from balconies, and we have a tradition of balconies in Italy, started socializing from a balcony to another balcony with by showing Italian flags and singing interesting and nice songs, even symbolic songs for Italy. Another one is the fact that at some point the Italian government raised a call, and the call was for 300 doctors for asking for volunteers, and this call had raised 8,000 applications for volunteers. So you consider the civic mindedness, which in a sense was not really unexpected, but it was beyond expectations. Other things was also the ironic mood that some local governors, for instance, the president of Campania, where Naples is located, had to communicate the prescriptions to people. So, for instance, he said to some point to all people wishing to organize a party for their graduation, well, we will join the party, but with the flamethrowers. Just to say, be careful. And even drones were used to find people, for instance, on the beach running. And there is a video that it is possible to find on the web with a person who is just trying to run. And when he realized that police is going to run in order to catch him, he starts even running more, and the police runs even more. So it's something which implies the possibility to find irony and ironic mood, and even salt, some kind of sense of humor in a tragic situation.
Thank you, Jessica. Thank you. Good to see you back. And just briefly about the compliance in the United States.
Yes, so the US, as you all likely are very aware, has a bit of an obsession with individual liberties, and there's quite a high distrust of government. And this notion of individual liberties is a bit at or counter to the public health focus that prioritizes a population's well-being over individual liberty. And so what we've seen is that while most people are willing to wear masks and distance from others, there's been a consistent, maybe 1/5 of the population in surveys who won't do it. And they've been encouraged to some degree by the president, who's been mocking mask wearers at times for appearing weak. And so we have this incredible tension, and as time goes, it seems that there is more pushback from complying to these protective behaviors.
Thank you. So it's almost 10:49, and I encourage the audience, if you have any question, you can type into the chat rooms. I will have my last question, then we will turn to the question Q&A session from questions from the audience. So my last thing I want to discuss is this pandemic has not only exposed the weakness in our healthcare system, but also exposed many socio-economic vulnerabilities in our societies. So this pandemic has further magnified a lot of economic, social, and health disparities. So what is the situation in your country? How did your government deal with any kind of a disparity across different populations, if there's any? So we can start with Professor Zhao again.
Okay, we did not find the significant magnified disparities in China during the pandemic of COVID-19. For example, we conducted the screening for all high-risk population. We conducted the isolations for all close contacts of confirmed cases and all suspected cases. Whatever their rich or poor, the screen and isolation strategies are the same. In addition, every suspected case has equal chance to take the nucleic acid test. and go to all and be sent to the hospital. So as far as I know, this pandemic in China has not led to the magnified social, economic, and health disparities. Yes.
Thank you. Jessica?
Yes, so as a country, we have a history of very extensive racial, ethnic, and income-based inequalities in healthcare access and healthcare outcomes. And this pandemic has really shined a light on just how unequal health outcomes are. I think many people in the country probably didn't understand the levels of inequality in the past, but now it's the headlines quite a lot of the days. So what we know is that Black Americans are dying at a rate 2 times higher than white Americans. American Indians are dying at a rate 1.4 times higher than whites. Interesting, Latinos are much more likely to be hospitalized, 4.6 times rate higher than whites, but the rate of death is only very slightly higher than whites, non-Hispanics. Your question about how will the government deal with this level of inequality? And I think the answer is it will depend on what the government is after the election in November. I think if we have this same government, I don't think there's going to be a lot of action, but I think the Biden government would be very committed to trying to address many of these inequalities. And these health inequalities are showing us structural inequalities related to housing and income and many other things. There's no way to just address this within the healthcare system. It's a much broader problem that's resulting in these higher death rates.
Thank you. Professor Bianchi, do you have any comments on or thoughts on this question?
A big problem in terms of economic and social disparities. You need consider that most of the Italian economy is based on small and micro businesses, and with also some cases, many cases of self-owned enterprises, self-owners, owners, entrepreneurs. And in these cases, we found many situations of people who lost their jobs, for instance, in bars, restaurants, etc. But even the owners may still today are in trouble in terms of continuing their own activity. Well, the government tried to find a response to this kind of problems into 2 main stages. One was when the problem arose, which was by the end of March, beginning of April, so that the financial support for households, workers, and businesses was deliberated, and that was, of course, needed to prove that some kind of states were caused by the current situation. And the second stage was in July. In July, the government decided non-repayable grants to be given to small and micro businesses and even individuals in business with big troubles, and even minor tax reductions and tax credits. There was also a lot of critiques. There were critiques regarding tax reductions and tax credits, and tax reductions and credits would have been for the future income. And actually, people would have said that the need was to have more funding. But you know, in these cases, there are always issues. But the most important thing is the possibility to rely now on the EU Recovery Fund. It was deliberated just about 1 month ago or so. It is 770 billion euros for all Europe, but 209 euros and billion euros are potentially for funding Italian restructuring plans, like restructuring in infrastructure, in the way a lot of sectors can be improved in terms of even to have a cleaner economy and even more transparent system in terms of doing things. So this is although this doesn't go directly into the pockets of people, it would facilitate for the future and will facilitate for sure the stability for people to run their own businesses.
Thank you, Professor Bianchi. I think we have a few questions coming from the audiences. A few questions I combining together because they're regarding the reopening schools in different countries. And this is a very hot topic in the United States right now. The question is, how have these countries prepared their schools for restarting? Are they at 100% capacity? So what other procedure has been in place to safely restart in-person classes for public school students? So, Professor, would you like to go first?
Yeah. I think different countries are different with this issue because China restarted the school, the public school or the primary school before the summer holiday. Everything I think is fine. So we have not found one confirmed case from the schools. So after the summer holiday, on September the 1st, all schools in China, including from elementary school to the college, all students will come back to school. So I think we have confidence to deal with it and to protect the students through the experiences before the summer holiday at schools. I believe we have fixed procedure to protect all students at schools. Yes.
Okay, Jessica, please.
So, like all of our policies around this, there has been no national policy. States are handling going back to schools in different ways. And in fact, school districts or counties are handling it differently. We're seeing a huge range from all online to all in person. Then New York City is giving schools the authority to make decisions, and students and families can opt to have the children online or in person. And what we're seeing in some places around the country is that teachers are threatening to strike. And at universities, we're seeing a lot of universities trying to go in person and maybe not putting in enough testing and structures in place, and then they're backing down. So UNC started in person, and after a week and a half, they have gone online, and followed by Wake Forest, and some other schools are changing policies.
So Professor Bianchi, are schools in Italy and back to normal, running at 100% the capacity?
We have a national policy regarding this, as it has been deliberated that on the 14th of September, schools will start again on site. I'm talking about schools, not universities yet. And there is a lot of discussion regarding this, as on the one side, there is a consideration of the strong need to have on-site classes for school students. But on the other hand, there is a problem associated with the differences we have in Italy, not necessarily north and south, but particularly from areas to areas. One thing is to talk about a school in a big city. Another thing is to talk about a school in a village. And this implies the availability of rooms, of classrooms I'm talking about, but even about simply furniture. There is a plan to change the kind of furniture in terms of desks, and there is still an idea or some kind of announced strategy by the Ministry of Education to have different kinds of desks that would inhibit contagion. But still, it is not clear when, how, and in what kind of format this kind of strategy will be implemented. So there is a lot of debate regarding this. Concerning universities, we will start on-site education only for classes with less than 30 students. So there is a lot of caution regarding education, but a lot of perception of the need to start again, to start on site.
Thank you. So another question, probably specifically for China, the Professor Zhao probably may answer addressed is, the question is, has China demonstrated the following? It is easy for a technology-savvy authoritarian regime to deal with this kind of crisis once it recognizes it has no choice. The second part of the question is, it is easy for a technology-savvy authoritarian regime to cover up its mistakes. What's your responses to this question, Professor Zhao?
Yeah, for the two questions is not easy for me to answer them. I try to answer them. As far as I know, there are no significant differences between the different regimes to address the pandemic of COVID-19. For example, many countries such as China, South Korea, Japan, Italy, I think these countries had done a not bad job for combating COVID-19. So, my answer is that I don't think there is a significant relation between the regime and the response. The response. If the central government or federal government tries the best to address the pandemic of COVID-19 must be conquered, whatever the regime is. The second question, I think my answer is similar to the aforementioned question. I do not think there is a relation between the regime and the so-called covering up mistakes. Actually, in response to this pandemic of COVID-19, most countries have made some mistakes. I think, yeah, China must have some shortcomings or errors or mistakes, especially at the very early stage of the pandemic. But I do not think it's covering up the mistake. Yeah, I think so. My answer is that, as far as I know, there is no significant relation between the regime and the response to the pandemic. Yes.
Thank you, Professor Zhao. And I'd like to piggyback on this question and flip it back to Jessica and Professor Bianchi. Does that mean that the democratic country or democratic regimes are not well prepared to deal with such kind of a crisis? Well, what do you think?
I can comment briefly that some of what I read about happening in China early on, where there was testing of people, and if they had high temperature, then they were sent away from their homes to be isolated. Those kinds of things, actions, I think helped prevent the spread from getting out of control in China, but those are the kinds of things that would not be accepted in the United States. And so I think there's a tension with the government being able to do more sort of drastic actions to protect people, which has some benefits, but it would just not be acceptable in a country like the United States.
Mr. Bianchi, what do you think?
This is a great question, I think, as this very puzzling issue also in Italy. As I mentioned before, we have two neighbor regions in the north, Veneto and Lombardy, and the behavior was totally different regarding testing. Testing was made, I don't know whether mandatory, but I think it was to some extent mandatory by Veneto. And on the contrary, there wasn't any testing policy regarding Lombardy, and was not only testing but also the search of the contacts of people. So that was an example of how you may find even in neighbor regions in the same country, different kinds people would react according to the fact that in my opinion, this is my personal opinion, a policy is designed differently. In Veneto, the policy was designed according to what I heard and what I understood, through a broader, much broader involvement by different stakeholders, particularly from healthcare experts. And that was the reason why presumably testing and intensive testing was recommended and adopted. On the contrary, it was a little bit more, probably much more autocratic, the way Lombardy decided, and the discrepancy between cases per inhabitant in Lombardy versus Veneto was unfortunately clear. That is a first example. Second example is about a software which was distributed in Italy in early June in order to track contacts, and the success of this software, unfortunately, was not good. People didn't, less than 10% or 10% of population downloaded this kind of software. I think this is a great point, and I don't think it is only a matter of democratic issues, but about the possibility that the policy design may come from the involvement of people.
Thank you. Thank you. It looks like in the United States and Italy, both countries have seen the very great regional variation across different states and regions. So next question from the audience is, according to the current development of vaccine in your country, when will you expect the socio-economic life go back to normal? Second, how well the process will be? Professor Zhao, do you want to give us some updates about the vaccine developing in China and how long China will go back to normal? And how the process will look like?
Yeah, I think China is a little bit different with the United States and Italy. Actually, China has entered the social, economical, normal life now. For example, schools are going to restart, and all people have back to work. So and the public gatherings are permitted. I think the social life have been back to normal. Although there are no vaccines. The second question, my answer is that. So China utilized a different strategy to maintain the balance between contain COVID-19 and reopen the economy. That balance is so-called balance. That balance is taken contain COVID-19 first, taken COVID-19 top priority. When the pandemic of COVID-19 is under control, the government reopens the economy. So I think that is the process of China. So first, we try our best to control the pandemic. When the pandemic is over, we reopen the economy. So I think that's our process. Yes.
Thank you. I think Professor Zhao raised a very interesting point regarding the reopening. It looks like a Chinese approach is more like a public health focused approach, and the ending lockdown alone won't restore confidence and growth. Only when the pandemic is under control will the normal life, economic growth will resume. But in the United States, we find ourselves forced ourselves into a kind of dichotomy of reopening economy and containing the viruses. So this is something I don't really quite agree on, but probably Jessica can elaborate on this point, whether in the United States a forced dichotomy is actually a right approach.
Yeah, so the Trump administration really thought it was sort of an either or, and that by focusing on eradicating COVID or controlling COVID, we were destroying the economy. And so he really pushed for the reopening before we got COVID under control. And what we've learned is that it's not an either or. You can't have the economy come back to some sort of regular normalcy when people are getting sick and scared to be getting sick. And so we have to control COVID before our economy comes back. And to the other question about getting to normalcy and vaccines in the country. So the best case scenario, according to Dr. Fauci, is that we would have a vaccine by the end of the year, and that's considered pretty optimistic. But that doesn't mean that there'll be mass vaccinations happening then. That's not going to happen until likely the spring or the summer. And where we are now with people's sort of reluctance to buy into COVID, polls are showing between 30 and 50% of adults are saying that they wouldn't take a vaccine. So there's a lot of questions about really when the vaccine will happen. Will people take it at levels that will be sufficient to get us to a safe place? And so it's really not clear, but I don't think we're going to see normal for a year.
Professor Bianchi?
Yeah, that's. I was thinking about all these things. I agree with what Jessica said before. As also in Italy, we had this kind of discussions. We had, as I said before, a very long lockdown period. After this very long lockdown period, which produced a lot of good results, Now we have an open economy at least in the country. But the problem is that this kind of opening, particularly because of tourism, but even because of also local movements from interregional movements and even inside the region, we have a rise in contagion. And there was a decision just a few days ago by the government to close, to lock again discos in order to avoid the jump into the contagion. So the situation is still not clear, even in terms of movements of passengers. I mean, people for tourism or for businesses from a country to another country. There are some countries in a blacklist, not in terms that it is not possible to have people from those countries, but there are severe controls done about people coming from other countries. So the problem is still felt as a very strong problem in Italy. And the feeling is that there is a risk that this kind of oscillation into the pattern of cases may go back and forth because of the stop and go in the economy. But we say in Italy we cannot have another lockdown because of financial reasons. So it's a big dilemma, big double bind, unless promptly an efficient and effective vaccine will be available. We also have anti-vaccine people, unfortunately. This is my personal opinion. Unfortunately, and therefore we have these issues as well. Hear me from
Okay. So next question related to the international collaboration. So the question is, do we have a mechanism for international coordination and collaboration? Some countries have disagreed with WHO, yet experience shows that the pandemic cannot be managed by a single country on its own. Another related question is, in government's pandemic response, do they have take into account the foreign political relationships? I think which means that is the relationship with the foreign countries, whether have any role in countries' pandemic response, if I understand this question correctly. Okay, Professor Zhao first again.
Yeah, I think we have certain mechanisms for the global coordination and collaborations on the pandemic of COVID-19 and some other infectious diseases, for example, H1N1 or SARS in about 20 years ago. I think we have a lot of certain mechanisms for combating the COVID-19, I think at international level. Let me take, I think it's normal. Some countries disagreed with WHO. Actually, during the pandemic of COVID-19, the international collaboration and the international coordination is not very good. At least it's not enough. All countries in the future, maybe to prevent the next new major infectious disease, all countries have to be together to prevent the new potential infectious diseases. Now the current relationship between countries is not enough. Yes.
So I can jump in and just say that there should be a more coordinated international effort, but the United States has not been pushing for such a thing. In fact, in the midst of this pandemic, the US has stopped its funding for the World Health Organization, which is really quite symbolic of the American first approach of the Trump administration. And the Trump administration, or Trump, has continually called this the China virus, which also creates a tremendous amount of tension. So I think the US has been counterproductive in trying to create an international effort to address the pandemic effectively.
Professor Bianchi, probably your comments can
we
in the
also in our country and in our continent in Europe at the EU level. When the virus spread initially, it spread primarily in Italy, and unfortunately we felt to be alone in Italy, just not to be supported, or in a sense to have support. This is the right verb, by the rest of the EU. In fact, also Mrs. von der Leyen, the leader of the EU, just publicly apologized for this kind of latent response by the EU in doing that. The immediate reaction of the EU countries was to abolish initially the Schengen treaty, which would have implied, of course, the possibility, the free movement of people between a country to another country. That's of course understandable, just in front of a big crisis like this pandemic. However, it was even hard for the EU, and I'm a big EU supporter, to find a consensus on a policy which mainly converges on financial issues only. Financial issues are very important, but not enough. When you, of course, you have to understand how to deal with the causes of the main financial issues, which were generated by this pandemic. So, in synthesis, I'm a little bit not really pessimistic, but as I am never pessimistic, but of course skeptic on the possibility to find in the immediate future effective coordinating mechanisms, at least in the EU area. Even though encouraging steps ahead have been done, so I have to be much more optimistic than I would have been until a few months ago. To my knowledge, there are not any other kinds of significant attempts of finding more coordination beyond the EU area regarding, for instance, my country. There are, of course, practices affecting the bilateral relationships, for instance, with Tunisia, with other countries from Northern Africa. Of course, we have big problems regarding immigration, and there is undoubtedly the risk that immigrants may bring more risks of infection. So there have been attempts and efforts by the national government to find agreements and the shared policies with some countries from Northern Africa. That is my comment to your question. I don't know whether my thoughts are symmetric to the regime of your question. I hope it addresses to some extent your question. your point.
Thank you, Professor Bianchi. I like your way to situate your comments in the context of EU. That's what we're trying to understand. So next, we have two more questions. So the next question is, how prepared is the academic community to counter conspiracy theories and misinformation, which has negatively affected the management of the coronavirus and may also affect the future vaccine plans? I think this probably more so in the United States than in China. But Jessica, would you start with that?
Sure. I think the academic community is one group that needs to counter conspiracy theories and misinformation, but I also think social media is probably more important. What I can say is that the studies that have looked at how you can message to get people who are hesitant about vaccines for their children to be willing to engage in, have their kids get a vaccine, there's not a lot of effective, or studies have found not a lot of effective messaging to help change people's minds. So I think the academic community will study this and will hopefully identify some appropriate approaches. But I think social media needs to try to stop the misinformation that is going rampantly through their forums.
Professor Bianchi?
I agree with Jessica 100%. The academic community can do a lot, but unfortunately it is pretty hard by the academic community, as we all know as academic people, to sometimes have the same symmetric level of communication to the we say in general Italian people from the road, and so in a better communication by people, maybe even academic people, of course, through the social media might be a good lever in order to change the mindset of people. Also, I have to add that good politics and good policy making and implementation may help in tackling this problem. In terms of political communication, the communication by the government, not really in terms of to make necessarily testing and the vaccines, in this case, compulsory, but in order to convince people with a clear data that vaccines may add a value, not really, or sorry, not may, I correct myself, will add a value, no doubt. This is my personal opinion. I think it is shared by many other people in this group. From what I heard from the previous comments, but unfortunately also in Italy we had this kind of movement of anti-vaccine people, even though it is like a wave. You know, in Italy, you have to know that when fascism was in a big power during the Second World War, many people were pro-fascism. Immediately after the Second World War, many people were in this kind of mood, said, no, I'm against fascism. Now, more people are saying, no, I am against the anti-vaccine idea. So Italians are a little bit more, how do you say, influenceable, possibility to influence them because of the movement of things. That's why good communication through the social media might be effective.
Okay, thank you, Professor Bianchi. I think you can't help talking about your expertise, policy implementation. Okay, Professor Zhao, just very brief about this question.
Yeah, I will answer it very briefly. First, this is a very professional question. Although I think his name is Donald, right? I think, of course, it's not Donald Trump. My answer is that the academic community has obligation to play an important role in it. Second, now the current relationship between China and the United States is not very good. The academic community between China and the United States on public health can stand together to do something more to help address the pandemic of COVID-19. Yeah, that's my answer. It's very brief. Yes.
Okay, probably the last question. We're running out of time, but still, probably I think I should comment on the last question. That is about the contact tracing. How has the population, Italy and China, responded to the government efforts to contact tracing? Are local governments in your country satisfied with the timing, quickness in contact cases and contacts, and completeness of the surveillance program to reach out to the program? So maybe just this question just for China and Italy. So Professor, you may go first. How the contact tracing program working in China?
Yeah. So for the close contacts, I think what China has done is pretty good. China, I think in any local areas, China utilized the big data. The big data, yeah, is from the it's specifically they used the cell phone numbers. Yeah, I don't want to tell the details. So we utilized the big data to catch all close contacts of one confirmed case in a very short time. I can give you an example. I have the database of one city. In this city, they have more than 100 confirmed cases. So they caught all close contacts. So I think, yeah, the longest close contact of one confirmed case, they used 1 hour. So 1 hour is the longest time for catching the close contact. So I think, yeah, the local government, I think all local governments in China are very satisfied with the timing of catching the close contacts. Yeah, I think that's my answer. So yeah, maybe I think that's one of the most important reasons why China can control the pandemic of COVID-19 in a very short time, because it's very easy for us to catch the close contacts of all confirmed cases. Yeah, that's my answer.
So thank you so much. We're just running out of time. I think we have to end it here. We really appreciate the 3 panelists for their insightful perspectives. I think this webinar serves as a very good forum for us to share our perspectives and different stories. So I would ask all of them and give our panelists a big round of virtual applause. So I just add my reaction here. Thank you for the participation. And just let you know that the Marxe School is going to host a series of online virtual programs. So check out the website. We're looking forward to your continuing participation in future Marxe programs. And thank you so much. And we really appreciate your efforts and participation. Thank you. Goodbye. Good evening or good afternoon in different places. Thank you.